when you first came here and I checked out your leg with the clot, and we had to arrange for an ultrasound and a review. Poor Gwenda here had to get loaded up into an ambulance, probably half an hour of paperwork accompanied that, transport back and forward to the hospital, all to get a review from a doctor. Whereas this morning it was all right at the bedside. He came to us.
Specialist's got to come to see me. I can't leave here, you know. He wants to know what's going on.
So how it would work, Len, is we would use an iPad here and you'll be able to look at that and see your specialist, and the specialist will be able to look at us as well. I'll also talk to your son and just explain to him what's going on so he knows.
We pre-arranged it. I sent him a photograph of something and a referral. Then we just made our arrangements, and it worked very well.
Morning, Dr. Peppard. Thank you for your time this morning. Since Len's been with us, he's put on 10 kilos, so that's really quite good. And you've got a copy of the blood tests to have a look at.
Very good the way you can, with electronics today, what you know, you can speak to each other and see each other.
Len found the telehealth consultation really good because he could see his specialist on the screen and have that one-to-one contact with him. Our residents in residential aged care don't get to see specialists as often as we'd perhaps like sometimes, particularly follow-up appointments when they come back from hospital or when they've seen specialists previously. Being involved in telehealth has really allowed us to have input with the specialist into what was happening with the resident, and we were able to give the specialist more information that they perhaps wouldn't have had if the resident had gone with a family member to a consultation. The other advantage is the GP's there at the visit, so if any medications need to be changed, he can do that, and if any blood tests or x-rays or anything needs to be ordered, then the GP does that immediately following the telehealth consultation. It wasn't difficult to set up the telehealth consultation because we had the support of Medicare Local, who came out to assist us with our first consultation, and then once we got the technology set up, then it's not difficult. What we did in a 15-minute appointment, was amazing compared to probably what would take half a day. I'd say definitely give it a go. It was really very beneficial for our residents.